So I would like to introduce our speaker, Peter Ferry. Just mentioned, the title is Utilizing Climate Services to Protect Health in a Warming World, Opportunities and Challenges. Peter Ferry has been working on climate change and health issues for over 20 years at the Climate Change and Health Office in Health Canada. Peter's research and papers include health risks to Canadians, adaptive capacity, health system resilience, health vulnerability assessments, and communicating climate change risks to the public. He is currently Senior Policy Analyst and Science Advisor to the Director at Climate Change and Health Office and serves as Adjunct Assistant Professor in the Faculty of Environment at the University of Waterloo, where he delivers a course on building climate resilience in health systems. Peter is involved in a number of national and international collaborations to reduce risks to health and health systems from climate change. He is an editor for the next National Climate Change and Health Assessment being led by Health Canada, which will build upon the report released in 2022, The Health of Canadians in a Changing Climate, Advancing Our Knowledge for Action. I'm going to put a link for that into the chat. He regularly provides expert advice to health authorities, both within and outside of Canada, on preparing for climate change. Among other collaborations, Peter has contributed to the development of a number of guidance documents and expert workshops for partners such as the BC Ministry of Health, the Ministry of Health and Long-Term Care in Ontario, Pan American Health Organization, the World Meteorological Organization, and the World Health Organization. His current research focus is on rapidly scaling up health adaptation to reduce risks from increased climate change impacts. We are recording this session. If you have questions for Peter, please post them into the chat and we will address as many as we can after the talk. Peter, welcome to the Ottawa CMOS New presentations. And I'll see if I can change the focus to.
Great. Well, thank you so much, Frank, and thanks to Dawn for the kind invitation to present today. Really appreciate the opportunity. We know that risks to health from climate change in Canada are increasing rapidly. We're seeing some major impacts. So I think this discussion is really timely on using climate services to protect health in a warming world. So I just appreciate the opportunity to be here today. Before I begin, I just want to acknowledge that I'm making this presentation from the traditional unceded territory of the Algonquin and Anishinaabe people. Next slide, please, Frank. So I've got probably too many slides, so I'm going to go fairly quickly, but invite people to contact me after the presentation if that's at all helpful. But really, I'll talk about Canada's rapidly warming climate that you're all very, very aware of course. Risk to health, really the focus of the presentation, risk to health and to health systems as well from climate change. How climate services and weather services and health is a key adaptation, the collaboration among professionals, and what some of the opportunities for this collaboration are to protect Canadians. Next slide, please. So, Canada's changing climate. Next slide, Frank. So again, you're all aware of this. We're warming rapidly globally. It continues. We've passed the 1 degree mark from pre-industrial levels in terms of this warming, and really importantly, certainly for health, but for many sectors, we're moving towards that 1.5 degree mark that was really the basis for the Paris Agreement, and that's a mark where certainly adaptation from a health perspective can become more challenging. So this warming is really important from a health perspective. Next slide. And of course, Canada's warming very rapidly. And in fact, the Environment and Climate Change Canada report in 2019 indicates we're warming about twice as rapidly as the global average. And certainly we're seeing and expected to see more frequent and intense extreme hot temperatures, an increased severity of extreme heat events, less extreme cold, increased risks of drought, increased risks of wildfires, and a number of other impacts. And again, we're seeing very severe climate hazards that are affecting our communities. So for example, the recent wildfire seasons have been quite, for some communities, quite catastrophic. So significant implications for health that we'll talk about. Next slide, please. And we can just flip over this. So, what are some of the risks to health and health systems? Well, we do know that increasing climate change risk to health will affect you, your family, or someone you know. You're probably familiar with these events. Record wildfire smoke in June, July 2023, a record ice storm in April of 2023, severe hailstorm July 2023, the same year, and severe thunderstorm in that year. I guess what's unique, certainly for me, about these, some of them record events where these happen just blocks from where I live and where I work. So, even though I've been working on these issues for 20 years, just really hit home, even for somebody like me, just how much the climate is changing and some of these risks and some of these impacts. Next slide, please. And certainly from a global level, we have increased evidence, and within Canada, we'll see about some of the possible impacts to climate change. So we do know, this is from the Intergovernmental Panel on Climate Change report 2022, climate-related illnesses, premature deaths, malnutrition, all its forms, and threats to mental health and well-being are increasing. We know that. And certainly a number of these risks are projected to continue to increase into the future because of the warming climate. But we can be effective in reducing these risks to health with timely, proactive, and well thought out adaptation measures. And what's really important is if we design these measures the correct way, and if we design greenhouse gas emission mitigation measures the correct way, we can actually achieve very substantial co-benefits to health. We can make people more resilient, communities more resilient. So that's really important to keep in mind as well. Next slide, please. So, Health Canada participates in the National Climate Change Impacts and Adaptation Assessment process. It's led by Natural Resources Canada. This is a snapshot of many of the reports. The cycle has just ended. The most recent cycle has just ended. This is a snapshot of many of the reports that, if you haven't seen some of them, might be of interest. Canada's Changing Climate Report from 2019, of course. A national issues report that looks at specific sector impacts and regional reports. And then I'll talk about the health of Canadians in a changing climate report. But the most recent report that I think will be of interest is the Indigenous Resilience Report, which I think is really, really excellent. So check that out if you have not already done so. Next slide, please. And so in 2022, February of 2022, our office, with many partners, we led the Health of Canadians in a Changing Climate report, the most recent assessment, and released it in February of 2022. And it really answers the following questions. What are the current projected impacts of climate change on the health of Canadians and on their health systems? Who is most at risk from these impacts? What is the status of health adaptation? How are we doing in terms of adapting? And how can we adapt to reduce health risks and develop more resilient Canadians and health systems into the future? And certainly working with our partners in the climate services and weather services, that was really important for developing this particular report. Next slide, please. And so, climate change has very complex drivers in terms of affecting health. And this figure, tries to capture a number of those drivers. So, upstream determinants of exposure and vulnerability are really important in terms of, demographic changes, economic growth, urbanization, inequities in society. And these can, combine and influence certain vulnerability factors at the individual level, health and nutritional status, socioeconomic status, even social infrastructure, which then mediates some of these climate exposure pathways and some of the actual impacts that arise from, extreme weather events, the kinds of things you'll be very familiar with, heat stress, effects on air quality from climate change, water quality and quantity, impacts on food security and safety, vector-borne diseases, and such. And what's really a bit new in terms of these this information is the possible impacts of climate change and some of the ones we're observing on health systems, on health facilities, and the opportunities for these health systems to prepare for future climate change. So this is, the information on the right here in terms of impacts on like the health workforce and service delivery and such. Next slide, please. And so, we are seeing some of these impacts, for example, on health facilities. This is from the assessment. Things like wildfires in BC in 2017 that actually, shut a number of hospitals, resulted in the evacuation of patients and staff, and really, cost quite a bit of money. We also seen in, Regina General Hospital in 2017, operating theaters that are shut down because of extreme heat events. In the north, they're seeing rising temperatures or melting permafrost requiring additional structural support for healthcare facility buildings. So right across Canada, we're seeing some of these impacts from climate variability and climate change on health systems, on health facilities that we need to be thinking about and we need to address. Next slide, please. And so this is, our effort in one figure to kind of summarize the roughly 800 pages of the assessment, really for communications purposes. So I'm providing some examples of the findings from that assessment. So I won't go into this in a lot of detail, but it provides these broad areas of health impacts that I mentioned. And we're hoping that this can be used by partners for communicating some of these impacts and risks with partners. So I thought to share that. Next slide. Perhaps for this discussion, some of the findings from the natural hazards chapter I thought would be of particular interest. So, we do know that many extreme weather events and their health impacts on Canadians are expected to increase in the coming decades, driven by this widespread warming. And so, certainly some populations in urban and rural areas that have limited access to financial, social, health, and human resources are more at risk. Seniors are particularly at risk from suffering the health impacts of climate change, like heat waves and snow, cold snaps, drought, wildfire smoke, and whatnot. And so there has been actually a lot of progress in terms of adaptation with, among health authorities and partners in other sectors. But with respect to natural hazards, some of the adaptation measures are still lacking, especially for droughts, storms, and heavy precipitation. So we need to really rapidly scale up some of these efforts to protect health in the future. Next slide. And we know that these events can really have severe impacts on health. So you'd be very familiar with the BC heat event that happened in 2021. Really record temperatures for many communities over 5 days. 619 people died over that time frame. So it's a very catastrophic event. Health systems were really impacted as well by that event in terms of paramedics that were suffering from heat stress and hospital emergency rooms that were exceeding capacity. So this is a really significant event and shows you what can happen from some of these hazards. Next slide, please. And so, health authorities are also really concerned about climate change impacts on mental health as another example. Floods, extreme heat events, wildfires, melting permafrost, and rising sea levels. They're all having adverse effects on the health and well-being of people living in Canada and on mental health impacts. So things like exacerbation of pre-existing mental illness, such as psychosis, even the new onset of mental illness, such as post-traumatic stress disorder with some of these extreme events, or even generalized and longer term stress, such as eco-anxiety or climate anxiety, that unfortunately we see in a number of populations like youth, for example. So this is a significant concern. Next slide. And by way of, another example, increase in infectious diseases that we're seeing with warming climate. So this shows a really rapid increase from Lyme disease or of Lyme disease in Canada over the last few decades because of that warming, because of the tick coming north into Canada. It's very interesting. Dr. Nick Ogden from the Public Health Agency of Canada almost 2 decades ago projected using climate modeling projected that this could occur in Canada, and certainly this has been validated by a lot of the work of the Public Health Agency of Canada and within the assessment. So a really good example of using climate information to really understand what some of the risks are that are facing people. Next slide. And certainly we know that there are really severe impacts of climate change on First Nations, Inuit, Métis people in Canada, because they're uniquely sensitive to these impacts because of a combination of historical context, cultural aspects, environmental changes, and social and economic issues. So, for example, Northern Indigenous populations are facing increased food security risk because of new challenges with harvesting, processing, and consumption of country foods. So the major issues that a number of communities are facing from climate change. Next slide. And certainly to be effective for health authorities and climate and weather services professionals to come together, I think we really need to recognize that climate change is transforming health decision making, really because of dynamic and complex disease risk. I mentioned vector-borne diseases, multiple uncertainties, around the management of indirect health risks, things like food insecurity, but also really importantly, the increased probability of surprises, things like combined or cascading events that can lead to complex emergencies, the risks of involuntary adaptation, and really the need for multi-sectoral and whole of society approaches. Next slide. And certainly climate services and health is a really key adaptation. And we know, I mentioned that we can be effective in terms of adapting to climate change impacts on health. The IPCC has indicated this, our health assessment, and also the World Health Organization. And so that's really important to keep in mind. Next slide. And certainly, climate services, weather services are really important for all stages of the health adaptation cycle. So this figure shows what some of these stages are that many health authorities in Canada go through. So things like building the awareness of climate change is a really important issue. These types of this type of information from climate and weather services can be really important for that. Undertaking your groundwork, research activities, so undertaking your assessments, surveillance and monitoring, really important. Doing climate and health research, very, very important. But then moving into implementing concrete adaptation options, things like emergency management activities, weather alerts and whatnot, doing health workforce training. Many of these are really important. But then, of course, evaluating how effective these actions are as sort of a last stage. And sometimes we need to be using climate services and weather information to do that with health information as well. Next slide. So this is an interesting framework from an updated framework from the World Health Organization. It's the operational framework for building climate resilient and low carbon health systems. Really provides a guide to health authorities about what are the key areas you need to focus on to prepare for climate change. And just an illustration that a number of these areas really require close collaboration and use of climate services information. Again, things like doing assessments on climate change and health, and even on GHG emissions, doing integrated risk monitoring, early warning, and GHG emissions tracking, and climate-related emergency preparedness and management. I've got a couple of examples in the next slide. So next slide, please. So, integrated risk monitoring, early warning, and GHG emissions traction, this is really about integrated disease surveillance and early warning, using that data on climate sensitive environmental risks, hazards, and epidemiological trends, collecting that information to be able to understand what the risks are and when you need to take action, but also monitoring and doing that tracking of progress. And so again, using information on climate change, health risks, impacts, vulnerability, health systems capacity to maintain sort of a really good eye on how risks are increasing and when you might need to actually change your adaptation efforts. And then certainly communicating this information through timely warnings is really, really critical. And a perfect example in Canada here is the collaboration among partners on heat alert and response systems that many communities have it during the hot months to warn people, prepare people for extreme heat events and heat waves. Next slide. And so, assessments of climate change, health risks, and GHG emissions really require collaboration and different types of information among multiple sectors, health, and again, climate services and weather services. And just as an example on the right, and this is looking at some of the GHG emission side of things, this is from the air chapter of the Health Canada assessment that really estimated that by employing mitigation strategies in line with keeping emissions under the RCP 6.0, sort of a moderate emissions scenario, Canada could avoid around 5,200 premature deaths every year in 2050. And so, this was analysis using climate modeling and health information to really show the benefits of taking some of these greenhouse gas mitigation activities. Next slide. And so, there's quite a bit of climate and weather information that's really relevant for health decision making. I won't go into too much detail just because of time, and you'll be obviously aware of this. But things like, short-term weather information or forecasts, hourly, daily, weekly, that can be used from a health perspective for short-term operational decisions, real-time syndromic surveillance systems that can provide really important information to health authorities in real time about, what they should be doing when there's a heat wave or perhaps a wildfire. Public weather advisories, applications of thresholds that trigger action plans like heat alerts. So many different types of applications. Next slide. And then from a much longer range climate perspective, that long range climate information, sort of that decadal information that can be used for long-term health infrastructure investments like hospitals, research investment, demographic and population models can be used in terms of health system planning with this climate information. And increasingly, this is more and more important as climate change continues. We need to be using this information. Next slide. So, what are some of the opportunities for collaboration moving forward? Well, who actually adapts to climate change health risks, and who do we need to collaborate with? Well, there's a big group of people. It's a big tent, certainly from a health perspective. Health system planners and administrators, like health delivery planners, emergency managers. Obviously, healthcare practitioners, physicians, nurses, nurse practitioners, home care workers, mental health care providers, but also public health officials, health communication, as I've mentioned, food inspection, emergency preparedness, travel medicine. And these folks work with many different partners, researchers, of course, our Indigenous partners, civil society partners, and also really importantly, particularly for this talk, is decision makers outside the health sector, climate and weather services partners, also people in the energy sector, transportation, water, and agriculture. So we really need to be working closely together on these kinds of these activities moving forward. Next slide. And we actually have some great information on good practices for implementing integrated climate, environment, and health sciences and services. And this is from a recent paper, I think, that's really great and highlighting some of these good practices. Things like, effectively communicating across sector, using common terminology, and enhancing joint communication mechanisms, ensuring that climate services are demand driven and really fit for purpose from a health perspective, the kinds of things that health authorities need for health adaptation, right? Also, ensuring that services are science and evidence driven. They really need to be robust in terms of the projections and whatnot, but also co-produced. Integrating these products and services so that they have both that health component and that climate services component moving forward. So it's really great that we have some of this information on good practices moving forward that we can use. Next slide. And so, there is in Canada a long-standing collaboration among, public health officials, meteorologists, climate services professionals. And so, I think some really important needs for collaboration moving forward to support health authorities in addressing climate change impacts are things like, these are just some examples, how to provide information to decision makers to protect health from, again, these combined cascading or cumulative climate hazards through predictions and warnings, the increased probability of these events, and they can have very severe impacts on health. What about the development of new or improved services through interdisciplinary collaboration to reduce risk from indirect and long-lasting health impacts? Things like impacts on occupational health or mental health. I mentioned that previously. Can we think about predictions and warnings that can help people protect their mental health? And how to deliver information and services to Canadians that's effective in changing personal behaviors, including among the most high-risk populations, children and infants, seniors, people with chronic diseases, socially and economically disadvantaged people and whatnot. So that's really, really important, is tailoring this information. And next slide. And so, Health Canada and federal health partners are, playing a key role in scaling up health adaptation moving forward. So, Health Canada, my office where I'm from, we have our Health Adapt contribution program, where in the past we supported health authorities in assessing and addressing risks. We've also got a HEAT program that provides information on either building or improving heat alert response systems and some of the communication measures. Our partners at Indigenous Services Canada have their climate change and health adaptation program, where they funded many health and adaptation projects across First Nations and Inuit communities since 2008. And certainly our Public Health Agency of Canada partners looking at infectious diseases, the Canadian Lyme disease research network, and other types of initiatives to monitor some of these risks, to understand through research moving forward what they could be. Next slide. And so, some examples in terms of these activities through the Health Adapt program. This is a multi-year program introduced in 2019 that really supported local, provincial, territorial levels in Canada to build that capacity, largely to undertake climate change and health assessments. So we funded 10 health authorities right across Canada to undertake these assessments. And certainly for a number of these projects, climate services and meteorological information was really important in terms of doing these assessments, understanding what the current risks are, but also what future risks are, to be able to get that information to inform adaptation moving forward. Next slide, please. And so we have many of these reports, these assessment reports that are available to learn from. We're hoping that health authorities across Canada learn from the processes that these folks went through, some of the reports, and we build that capacity to get that science and get that evidence moving forward that we really need to protect health. Next slide. And really exciting, last year, the National Adaptation Strategy was released, and health and well-being is really a key pillar of that strategy, with a number of key objectives moving forward. Current activities really focus on building climate resilient health systems, but also preparing people for extreme heat as a really significant climate hazard. And again, collaborating with many partners outside the health sector is really important, particularly climate services and weather services folks on things like heat alert and response systems. Next slide. And so I certainly don't need to tell you about this, but for health partners, there's an awful lot of information that is available to them for these kinds of activities around, climate services and weather services and whatnot. So certainly the Canadian Centre for Climate Services at Environment Climate Change Canada, a number of regional centers in Quebec and Atlantic Canada, in Ontario and BC, and even the Climate Atlas of Canada that is integrating information about health impacts of climate change. So really lucky to have this information to help us plan for the health risks that are increasing in Canada from climate change. Next slide. So maybe just the last slide in terms of thinking about moving forward. And things to keep in mind when we undertake this collaboration. So certainly we need to be proactive in our risk management activities and can't get caught in an ineffective cycle of responsive or crisis adaptation. So this really need well-planned adaptation measures moving forward. And of course, we need to focus on managing future risks and not just historical risks. And this is, where this information, this climate information, is just so important moving forward. And also, we need to achieve health co-benefits of our actions. It's really, really important, like increasing health equity, reducing chronic diseases, and improving mental health, and employing iterative adaptation evaluation. So we need to evaluate as we move forward, how are we doing? Are we protecting health? We can't afford to be ineffective as climate change increases, because the impacts and the costs are going to increase if we're ineffective. And so that evaluation is really quite important moving forward. So with that, I believe that's my last slide. I just thank you again for the opportunity to be here. And I believe we might go to questions now. Thanks so much, Frank.
Well, thank you, Peter. That was absolutely stunning. It was so stunning, in fact, that you've managed to transfix all 27 of your audience, and only one person has managed to put anything into the chat. Rather than give him priority, it is our previous chairman, so I will give him priority in a minute. Rather than do that, however, what I might suggest is that people can ask their questions verbally if they wish. While they think about that, the question from then, sorry, I've got one now from John Reed, so I'm pushing them a bit. Then Barry has said, in the Health Adapt program mentioned on slide 33, which I can go back to if you wish, there is no activity shown for the prairie provinces. Would you like to comment on that, please? Do you want me to go back to slide 33?
Yeah, no, thanks for that. So
I've lost it.
No, that's okay. So this was a competitive process where we invited proposals for this Health Adapt initiative. And so I'm trying to remember now. I'm not sure that we received many proposals at the time from those provinces. So it really would have been a result of this competitive process, this robust process, to evaluate those. And I think that's perhaps what happened. But we're certainly hoping that the diversity of the projects that we did have, in terms of Indigenous partners leading certainly one of the projects and being involved in a number of them, having some rural focus projects, larger cities leading projects, and having a geographical spread across Canada, that many health authorities can actually learn and can sort of see themselves in those projects and learn from them. So that's certainly the hope.
We'll give Len an opportunity to see whether that's a full answer to your question. Meanwhile, John Reed has asked, compared to many countries, Canada has a relatively robust infrastructure and social services to mitigate local health impacts of climate change and variability. What health impacts can be expected in Canada resulting from societal disruption from climate change impacts elsewhere?
Well, I mean, this is something we tried to look at in the assessment. Is a really important issue, of course, of how some of these impacts outside of the country could affect Canada. And because we were focused on health impacts, there's just not an awful lot of information in terms of, certainly at that time, in terms of very specific risks to the health of Canadians from these kinds of things. But certainly in some chapters, so in the food chapter in the assessment, in our assessment, it really highlighted that food systems broadly are being impacted in Canada, certainly internationally, by climate change, and certainly there's a potential for significant impacts to food systems and significant impacts to food, in terms of food accessibility. And so, that I think is one example of where broader kind of impacts that go outside of Canada could certainly affect the health of Canadians. And as I recall, that chapter really highlighted to the inequities that can exacerbate impacts on health from food disruption. So, that was an important, I think, finding in the assessment.
Sounds good. There was one question which occurred to me. You had a good comment back on slide 28 about collaboration and collaborators. We have a fair pool of expertise in the audience which you've got here, and in CMOS in its local connections. Do you have any suggestions about how we might improve our messaging, what we can do to collaborate, are there opportunities for offering expert advice, etc.?
Yeah, thanks. I mean, I really appreciate the question. So I'll start that from in terms of where a lot of health authorities are, because then I think it's helpful to see where some of this information can kind of be either injected or where's that window of sort of collaboration. So many health authorities are undertaking these climate change and health assessments. I mean, that's really the starting point. You really have to understand what are the risks to health, who are the high risk populations that you should be concerned about in terms of wildfires and even infectious diseases, things like that. And then starting to develop their adaptation plans, their health adaptation plans, and then getting into monitoring and evaluating. Now, climate services and weather information is really important for all of those activities. And so as these health authorities are undertaking these activities, they're looking for experts, they're looking for information, climate information. And sometimes they don't actually have the expertise to use some of the sources that I mentioned that are out there.
Yeah.
And I think there probably is an opportunity to be able to provide some of that expertise to help them integrate that information into these kinds of studies. So certainly from that broader assessment perspective, and this, I mean, this is a wonderful question, Frank, because we're now launching the next National Climate Change and Health Assessment. And these are big projects, as you know, and certainly the opportunities for input from experts such as yourself and others around the table is would be quite helpful. I will just mention too that it's not just from this broader assessment perspective, but obviously we're seeing these risks from specific hazards. I mean, we're seeing these really dramatic events, right? These wildfires, these heat waves. And health authorities are having to adapt to those. They're having to respond to those, and they're having to learn about how to do that most effectively. And I think from that issue-specific area, there is that opportunity too to be able to provide some of this information, this expertise, hopefully.
Yeah, there were a lot of links to publications which you provided. I've just put in what I think is the overarching link to the climatechange.ca publication. Correct me or correct the link if it's not the right one. However, what is the best way of providing a succinct list of all the other links which you provided? Because our normal way of disseminating these recordings is to put them up on YouTube, which isn't a very good way of providing live links. Do you have an appendix, a summary, a bibliography of those links, which we could circulate perhaps as part of the YouTube posting?
So I'm happy to provide that afterwards if that's useful, Frank, for sure.
I think it would be. When you talk about lots of resources, it'd be helpful to be able to get back and find out the exact one that we need. Another question from Len. Sorry, excuse me. Another question from Len. The Lyme disease trends, which you show there, ended in 2017. What's happened in the last 7 years? Have there been any changes as adaptation measures affected the change? I know that healthcare treatment for Lyme disease has changed quite considerably. What has been the overall effect?
Yeah, so thanks. And I think Len caught that I have an older slide there. So the Public Health Agency of Canada, on their website, they actually have the latest data. And I think I have updated my slide, but I failed to put it in this presentation. So I think they have data up until 2022 or perhaps even 2023. We're seeing an exponential increase. So that line is just continuing to go up with some variation. But it is continuing to increase. And I didn't mention in my and maybe if I can find it now on that slide, Dr. Ogden and his colleagues actually did some estimates of future costs. Again, I think using climate modeling in terms of Lyme disease, and they're really quite large. So, projected annual Lyme disease cases for Canada range from 120,000 to over 500,000 by 2050, with these very large associated costs. So they've tried to project some of this into the future, and I think it's based upon some of the trends that we're seeing.
Good, thank you very much. No other questions appearing in chat. People are welcome to unmute themselves if they wish to ask a verbal question. I think we have plenty of time to do that. Thank you, Peter, for now. Dawn? You have to unmute yourself, though, Dawn. That's okay.
Yeah, I had two questions, and I tried to put them up, but I did it wrong. The first one was, you were talking about Lyme disease. What other diseases are creeping up to Canada that perhaps we wouldn't have expected a couple of decades ago? And my second question is the increased warming providing economic opportunities, for example, for crops that we might not have been able to viably grow before? And if I could just add one comment, I'm delighted to see attention to mental health. I'm just wondering if you had any pushback on that one. It's a very real issue for many people, I know.
Yeah, no, thanks so much, Dawn. So, I mean, I think on the infectious disease one, this is not an area that I have a lot of expertise. Our folks at Public Health Agency of Canada really lead this. And actually, I've mentioned his name, Dr. Ogden. He actually led that chapter in the National Health Assessment. So he's really a leading expert in this area. But I do know that there are concerns about things like Eastern equine encephalitis coming into Canada. Things like hantavirus, being increasing in Canada. Even things like malaria, the possibility. So there's actually a broad range of these kinds of concerning diseases that are highlighted in that chapter. So I'd invite you to have a look at the chapter because there's quite a bit of really helpful information there. And to your point about mental health, yeah, I mean we've seen I think a real explosion in the last few years about concern from health authorities, from people outside of the health sector, from sort of everybody about these impacts that we're seeing from climate change on mental health, and so certainly things like somebody experiencing a flood, and then there are, I think, stories in the assessment or kind of otherwise of children watching a TV where it's raining on TV and they have a very adverse reaction because of the experience that they've gone through in a storm or a flood, right? So there's a lot more information about that. There's more information about again these longer range, sort of this climate anxiety that's being reported in the literature, and a lot of concern about this. So we have a separate chapter in the assessment on the mental health impacts of climate change, authored by my colleague in our office, leading expert on this, Dr. Katie Hayes. And so again, invite people if you'd like to know more about that. We're hoping the next assessment, we're certainly going to have another chapter on mental health impacts of climate change. But what's really exciting for me is we're looking to, and this is still tentative, we need to have everything sort of approved and whatnot, but hoping to have a separate chapter on climate change impacts on children and youth. And I think that would be a really helpful chapter, really exciting chapter. Have a lot of youth engagement in that, and I think that this certainly would be an important issue that would be highlighted in that chapter, mental health impacts of climate change, as it was in the chapter on climate change impacts on Indigenous peoples living in Canada. There was a lot of information there on that as well. So yeah, Don, really important issue.
Thank you.
May I ask a question?
Absolutely, yes.
Okay, this is Richard Asselin. When you show the exponential growth of all kinds of health impacts, including diseases and temperature and so on, in Canada, this is a little bit new for us. But obviously, this kind of climate that we are experimenting now, it already exists in many warmer countries, like the southern US, the South America, and many other places around the world. What are we learning from them? And do they have such an exponential growth of things that they can't cope with them?
Oh, that's it's a really great question. We do, when we do these assessments, we do try and look at what we can learn from countries outside of Canada where the information is relevant to Canada, right? Because in some, certainly in some countries, it's perhaps less relevant. So we try to learn from that. I think that some of these issues, relatively speaking, are just so new, right? That health authorities in many countries are really kind of learning about what's the most effective way to handle these issues. There's still a lot of research gaps. So, for example, just on what are the most effective ways to adapt to some of these hazards, there's still a fair amount of research that needs to be done to kind of validate and to test that. In terms of extreme heat or wildfires, many of these hazards. So there's still a number of really important knowledge gaps, but there are new opportunities to learn from international partners. So recently, maybe 6 months ago, we collaborated with the Pan American Health Organization to hold a workshop that they led for countries in the Americas on building climate resilient health systems. And so learning from some of the activities in many countries in the Americas, because there is a lot of activity in terms of preparing health facilities, dealing with heat waves. And so to your point, we really can learn from a number of these countries. Health Canada also participates quite closely in the ATTACH initiative, which came out of the COP26 commitments. It's led by the World Health Organization, and it's the Alliance for Transformative Action on Climate and Health. Really exciting. It's only a few years old, but it's got about, I think, something like 80 countries that are part of it, and they're collaborating to share information on how best to scale up climate change and health assessments and develop these adaptation measures. And so, the last 5 years for me have been so exciting because the level of activity and collaboration in the health sector is actually just exploded. And so those opportunities for learnings, I think, will continue to grow as well.
Thank you. Richard, I had to turn your microphone off. You can turn it back on again.
Well,
Peter, a question from Bob Jones here.
Go ahead,
ask
Bob.
a question? Yeah, just a very brief one. We were talking earlier about updating slides, and we found one, I think you said, that was a bit old. The other thing that you might want to update is that I've seen a lot of presentations on the increasing amount of CO2, and it looks like some of the ones I've seen, I think they're validated by many models, is that we are pushing close to 1.5 if we're not at it already. And you might want to look at possibly updating that one particular graphic. It's perhaps a bit more serious than even one is.
Yeah, no, thanks, Bob. I really appreciate that. And we'll certainly look at that. And these are things that, as you well point out, we do need to update, constantly for sure. Make sure we have the latest information. Thank you.
Well, we're well ahead of time. Any other questions? If not, I think I'm going to thank Peter very much for taking us through that huge amount of information. And we look forward to the bibliography and all the help from that. If there are other people that want to comment, and I'm sure you'll accept emails and so forth, which we can pass on if they don't have your address. So from me and from all of us, Peter, thank you very much indeed for opening this session. That was very, very good. Thank you.
Thank you so much. It was a pleasure.
Yeah.